Did you guys know that infertility is actually relatively easy to fix? I mean, it's crazy easy to fix. The cause is so simple and everyone misses it. I mean, even the specialists that are supposed to know everything, they don't necessarily catch this really simple thing about infertility. Infertility is also caused by the same muscle that causes low back pain. So they go together. All cases of low back pain come from a spasm of the psoas major muscle. The genitofemoral nerve is the only nerve that connects the ovary to the central nervous system. So without the genitofemoral nerve working properly, the ovaries are not going to work properly and you're not going to have a cycle. Infertility is definitely in store. The genitofemoral nerve is getting pinched by the psoas major muscle. So the psoas major is the key for infertility, and it's the main muscle that causes low back pain because it's the strongest muscle attached to the lumbar vertebra. Okay, so today we're doing infertility. Cramps. You know what else is involved with this? Ovarian cysts. If you get the psoas major to release, the ovarian cysts will always drain. I know it sounds crazy, but they've always drained every time I do this technique on somebody that also has low back pain and the other associated problems. Ovarian cysts is the third thing, and then low back pain. Or as they say in Colombia, lumbago. So, infertility, cramps, ovarian cysts, low back pain, and they are caused by the psoas major. Can you read it? Okay. When it's tight, here, let me show you over here on this picture. The psoas major is this muscle right here. And as you can see, these are the lumbar vertebra. Well, you may not know that, but these are the lumbar vertebra. You can see the psoas major attaches to the lumbar vertebra. And when this muscle is tight, it pulls all those lumbar vertebrae forward into the abdomen. And it's definitely the strongest muscle attached to the lumbar vertebra, which is why if there's any muscle to look for that might be tight causing low back pain, it's always going to be the psoas major. So the psoas major, it also has the ovary just on the inside for women, obviously not for men. And the nerve that goes to the ovary comes out of L2 and L3. It goes through the muscle on the way to the ovary. And because it goes through that muscle, if the muscle is tight, it's going to pinch the nerve, the genitofemoral nerve, before the nerve gets to the ovaries. So the ovary is not going to be talking to the central nervous system. It doesn't know what time of the month it is and so on. So this is a cause of infertility. To release it, all you have to do is release the psoas major muscle. So let me go ahead and show you the technique that I use for that. What I do is if you have a tight psoas, then you have to go on there and you find it, and it attaches to the lumbar spine. So you get a pressure point release there, and you try to feel a release, send a release back into the lumbar spine, and that'll relieve low back pain. So this is how you do it. Make sure that you get that yang-yin pulse, so you slowly increase your pressure, make it then feel like you're slowly backing out, triggering a release. And if you can get this psoas major to release, I promise you, if a cycle hasn't been happening for a year or two, it will start tomorrow morning if you get this muscle to relax. I promise you, and low back pain will always go away.
Does it also help with cramps?
Yeah, if cramping is caused by the psoas major muscle, and what triggers cramping is actually impingement of that genitofemoral nerve by the psoas major. So it definitely resolves cramps like nothing else. Better than any medication. And there's no surgery for this that works, right? I mean, this is the only possible way to get this to let go, to reverse infertility, and to get low back pain to go away.